I will wait for your cue to start.
Yeah, I think we can start.
Please go ahead, yeah.
Good morning, good afternoon, good evening, depending on wherever you are joining us from. My name is Filiz Odabas Geldiay. I'm the Executive Director of International Association for Human Values. I'd like to welcome all of you to our session today. It's a great honor for me to be moderating this session between two such inspirational leaders. Gurudev Shri Shri Ravi Shankar is joining us from the Art of Living International Headquarters in Bangalore, India. And Jagan Chapagain, Secretary General of the International Federation of Red Cross and Red Crescent Societies, joining us from their headquarters in Geneva. And I'm in Washington, D.C. Jagan Chapagain has extensive experience and a broad knowledge of the International Red Cross and Red Crescent movement, having begun his career as a youth volunteer at the Nepal Red Cross, advocating and representing community voices. He provided leadership in responding to large-scale humanitarian crises and in building resilient communities in many different parts of the world. This dialogue is part of a series of talks Shri Shri has been initiating and held over the last few months with many influential world leaders. It's about a subject that affects all of us and that we are all concerned about, and that has become increasingly urgent: mental health and well-being, COVID-19 and beyond. We live in an increasingly volatile world. Yesterday's massive explosion in Lebanon is the most recent example of that. This deeply troubling outer world can result in an ever far more difficult to manage inner world for all of us. With more and more uncertainty in our daily lives, it is even more important that we are able to manage the stress we constantly feel. I wish we had more time to devote to this important subject, but we have only half an hour, and I have just about 1 million questions to ask to my guests. Shri Shri, may I start with you?
Yes, Felice. Go ahead. Yeah.
You have been a great advocate of mental health long before COVID-19. Other world leaders, such as the UN Secretary General, are also expressing their commitments to placing mental health at the center of any action to recover from COVID-19 pandemic. Can you please give us your perspective on this?
See, a strong mind can carry along a weak body. But the other way around is almost impossible. A weak mind cannot carry along a strong body. So, mental strength plays a very important role, especially during disasters and pandemics like that. If people are not strong enough mentally, they need more help than they can be of any help to anybody else. So, even for volunteers who are there to jump, I have been hearing Red Cross all our life, and they have been doing tremendous work, around the world. Let me congratulate both Red Cross and Red Crescent that they have been an example of service activity in the world. At the most needed time, whether it is floods or it's fire accidents or it is man-made disaster or natural calamities, Red Cross workers are always there. And they have been an inspiration because I think it's been there in existence for maybe more than 100 years now. Am I correct, Mr. Jagan?
Yes.
So On the other hand, I would say service is an activity that gives immense satisfaction to people. People around the world, whether they are part of any organization or not, there is that innate uh, drive to serve and to raise to the occasion. For this, I would say mental health is very, very vital, whether for volunteers or for the victims for suffering any sort of physical or man-made calamities like what we saw yesterday. It's the mental health, mental strength, inner strength that can help them to cope up with the situation. I've seen this during um, world during the tsunami which took the world, in a very big way. And Katrina, the floods, Katrina that happened in America, a tsunami in Far East. Mental health, really, really very important. Because without that, people, with suffer a great deal even after the calamity is over. For example, tsunami happened only for a few minutes. It just couple of minutes only it happened, but the impact of it was there for months together. Fishermen would not even look at the ocean, turn and look at the ocean. For them to get that mental strength, to get back to their work, was a Herculean task. Yeah.
Yeah, thank you so much. It's very true. We do need a strong mind to really deal with anything and everything that comes our way. Mr. Chapagan, may I call you Jagan?
Yes, please.
Just as Shri mentioned, when I was growing up in Turkey, in my homeland, wherever a disaster happened, the moment we saw the tents set up by Red Crescent, we knew we were in good hands. You had the trust of the people, and that continues to be the case. You have been at the forefront of responding to large humanitarian crises in many different parts of the world, we all know. And you are there not only when the crisis happened, but long after that as well. How do you see the role of mental health? Could it be a tool to help in the recovery process?
Thank you, Phyllis. And let me start by really expressing that how grateful I am to join Sri Gurudev on this conversation. I have known about you, Gurudev, for many, many years when I studied in India. And I have listened to you, and I have also observed the great work you have been doing, and of course your foundation have been doing. So I really truly feel honored that today I join you in this conversation when we are discussing mental health. So really thank you for offering me this opportunity, Sri. But I also want to take this opportunity to spend 1 minute to reflect on what happened in Lebanon yesterday. Dozens of people who lost lives and thousands of people who are injured, and of course thousands of houses which have been damaged, and many of my colleagues have to spend the night in the hotel in the middle of the COVID-19 situation. So of course our thoughts and prayers goes to all those population in Lebanon who have been affected, and of course our own colleagues who have been there to help others. But now they find themselves in a situation that they have to be looked after. So really wanted to express our solidarity with the people of Lebanon, and of course our colleagues and friends there. As you described, of course, we have been responding to many, many crises around the world. And I think the very important part of our work in the Red Cross Red Crescent is we are there before the crisis, during the crisis, and after the crisis. And that before element is very, very important. Because at the time of crisis, there has to be a trust among the population and the people who are there to support them. And that trust cannot be developed in the middle of the crisis. And if you are not there in the community before, and if you haven't established that relationship before, that trust doesn't come during the crisis. And when there is no trust, there is no partnership. And there is no successful humanitarian program without a trust and without a proper partnership. So we absolutely emphasize the aspect of being there before, being there during, and being there after. Now, why I'm mentioning this, the issue of trust here, is if you are in a distressful situation, you have lost your loved ones, you might have lost your property, you have lost your livelihoods, you are in a distressful situation, and you have to be partnering with people you don't know before or you don't have trust with. That increases the mental stress. That increases the stress on you personally, on your family, and on your community. So having that trust becomes extremely important. Now, what we have seen is at the time of crisis, generally the mental health issues, psychosocial issues, generally doubles. When Sri Sri was speaking, I was just making a quick count that in the 30 minutes there will have been 45 people being killed by suicide. 45 people. Every 40 seconds, somebody is killed by suicide. And that's pre-COVID situation. So this is just to show an example that how the crisis and disasters and the pandemics actually puts up exacting tolls on the population, and some of them actually feel a need to take their own lives. So having that mental health and psychosocial support becomes extremely important for recovery itself, but also in sustaining the life in the future. And in Red Cross Red Crescent, we say that there is no health without mental health. You cannot have health without mental health. So now, how do we actually do these things in the Red Cross Red Crescent is really including the psychosocial support and the mental health support through very practical means, engaging the communities, engaging the families, engaging the loved ones in what we do, how we design program, how do we deliver program, how do we actually manage the programs in a trustful environment becomes very, very important part of bringing that dignity to the population. And this is one thing I really wanted to talk about, just 30 seconds. A lot of times we talk about distributing foods or blankets or tents or whatever. That's not what our objective is. Our objective is to bring the dignity to the population. If somebody can take a shower after 2 weeks, we are bringing dignity there. It's not about shower, it's about dignity. So that's why how we carry out a humanitarian program and how humanitarian response either brings dignity or doesn't. And that's one of the reasons, including the psychosocial support, including the mental health support, actually avoiding the stigma, avoiding the discrimination is part of bringing the dignity, is part of the recovery process.
Thank you so much. It's so true. I guess dignity really is the central goal here. My next question is to you, Sri Sri. Many of our listeners are probably parents to young children or teenagers, and who are at a loss as to how to shield their children from the long-term consequences of this lockdown. In the absence of information, we tend to leap to the worst-case scenarios. In your great wisdom, please share with us what are the long-term effects of this pandemic, and how can we mitigate its effects, especially on the young generation? Thank you.
As humans, we're all very social, and it is very important that people interact with each other. Thanks to the technology, this time we are anyway interacting through social media and cell phones and all FaceTimes and all that stuff. But still, we can't stay in the virtual world for too long. We need to come together, help each other. Here, volunteering will make a very big impact. If our young people starts volunteering, and volunteering should start from a very young age, then it puts others above yourself. Service is putting others above your own needs. when this tendency develops in human society, we will find a very different scenario altogether, where we will be able to combat the suicide, which is inflicting pain on oneself, and on the other hand, the aggression that people are doing, the violence in society that's happening, whether domestic violence or societal violence, that should, that can be countered as well. So our youth today and young people are swinging in two extreme divisions. One is extreme mindsets. One is they are either aggressive and they go and help others, kill others, aggressive and go and kill others. On the other side, they are depressed and they lock themselves in and they commit suicide. It's very alarming to know that every 45 seconds one commits suicide. That people are committing suicide every 45 seconds. And when people sit and think about only themselves all the time, what about me, what about me, what about me, they get depressed. But if they join organization like IAHV, Art of Living, or Red Cross, Red Crescent, so they jump into action to do something and keeping others above one's own greed and need. So I think it is very important. In Art of Living, we don't have to tell people to go and do some service activity. In Lebanon, for example, just this evening at 5 p.m., 2 hours back, I had a conversation with our volunteers from Lebanon. They told me about 100 casualties are there and 4,000 people are injured, and they're going to the hospitals. And we have a team of doctors who are practicing yoga and meditation, a part of Art of Living service activities, who are in Lebanon. They're all there. In fact, some of them are also part of Red Cross, Red Crescent, and they're also participating in Art of Living. So one thing I would say is here, they should all do some meditation. It's like having, a PPE kit for oneself, mental PPE kits, so that you save your mind or your own energy from getting drained and burnout. Often people who go out and see, we have conducted some programs for Red Cross people also in Africa and in some parts of India, also in Philippines and many other countries. What we have found is when people are doing selfless surveys, when they are 100% into action, and they see day and night these disasters and pain and suffering of others, they get themselves very much traumatized. They themselves feel a sort of burnout. I've seen people saying, well, I'm burnout, I cannot. In these situations, for them to get a little relief inside, meditate a few minutes, do some breathing exercises, breathing techniques, and do Kriya, so the sky techniques, tremendously empowers them. They find themselves fresh and alive again, even after working all day. In the evening, they find themselves not so worn out. So we have to take care of our volunteers. I find it very, very important, because these are these are the pillars of society in times of need. That we cannot afford to see them getting tired and worn out.
Thank you so much, Shri. You mentioned meditation, and I remember that last week, actually, I read about a study by Yale and Harvard universities on the sky breath meditation and its effects on the young people, how positive that is. Thank you for sharing that. Jagan, if you have any similar concerns for young people, young generation yourself, I'd love to hear that. But also, as a follow-up question, what are the mental health and mental well-being challenges that the Red Cross workforce, many of whom are volunteers, are facing? And what are you currently doing to address that issue in your community?
No, thank you for that. Maybe just to add on what Sri already said, I think living with a purpose and a purpose is extremely important for young generation, but for everybody. And I think if you are living with a purpose and for a purpose, then your energy and your mind and your focus is on achieving something for others, not only for yourself. And I think that can be very fulfilling for you personally as in your life, but also I think that helps you also manage your in your well-being and your health, including the mental health. So I was very glad to hear from Sri these very important tips for young people. For us, it's very important part of our work, particularly now during the COVID-19. What we call is the care for the caregivers. It's of course, when we developed our strategy on how to respond to the COVID, we designed it around the 5 pillars. And the number 1 pillar was duty of care to our staff and volunteers. Because if we don't look after our staff and volunteers, they will not be healthy enough to look after others. And that was very important. As you know, when the COVID sort of spread in many countries and many governments went into the lockdowns, unfortunately, sometimes without enough preparations and without doing analysis of what the consequences of those massive lockdowns would be on population. But for us, our volunteers had to go out. When others went into the lockdown, the volunteers and staff had to go out because that's where the activities were happening. They had to run the ambulance services. They had to visit elderly populations. They had to visit isolated populations. They had to visit people who could not get to the hospitals. They had to get to the isolated communities who didn't know what to do about it. They also had to go out and get the right information. One of the biggest tragedy of this COVID-19 has been the spread of the wrong information. What we call infodemics, all sorts of nonsense going around in the media, in the social media, and that's confusing the ordinary population. So getting the right information on what to do, what not to do, and what are the behaviors we need to put in place, extremely important. So in this situation, ensuring the duty of care of our staff and volunteers became a number 1 priority. That means getting them the right information and the right training, and that also means that getting them the right protective equipment, the PPE materials, and also making sure that there is enough rotations and we are not unnecessarily exposing them to the danger. But as Sri said, a lot of these volunteers come with the motivation. Nobody tells them what to do or not to do. So in February, when we had the first volunteer who unfortunately died of COVID in Italy, we were analyzing that what the impact of that death of our volunteers in Italy would have in many other countries. And what we found was that did not deter any volunteers to turn up the next day to do what they were supposed to do. They are that committed. So ensuring that information, support, PPE materials, and also ensuring that they are not overexposed has been part of our duty of care. Also, there are some other mechanisms, ensuring, providing the insurance for the volunteers. Also, in unfortunate case of death, a mechanism to support the families. So we are putting all these things together to ensure that the volunteers who actually put themselves at risk are taken care of to the extent we can support them. And here, one very important element I also wanted to use this platform to highlight is, unfortunately, in the beginning, the message came is, we need social distancing. And we came very quickly to say that, no, we need to keep physical distancing, but we need to keep closeness socially. And that was a very wrong message. And unfortunately, even today, the message of social distancing keeps coming. And that's the social distancing is one of the big reasons for the psychosocial issues and the mental health issues. So while we maintain the physical distance, it's very, very important that we maintain social cohesion through social media, through calls. We can find all sorts of means now to ensure that our loved ones are not feeling isolated. So I really wanted to use this opportunity to highlight that physical distancing, but socially closeness. That's extremely important message we need to convey.
I couldn't agree more. It's so, so true. And with this conversation, maybe we'll try to change that phrasing a little bit. And I know that Shri, you have also come up with an interesting suggestion to take off a week every year for a voluntary lockdown. So that people learn how to calm down and stop this rush that we have been in. So very different way of looking at the same problem. Shri, I know that when this lockdown started, you had initiated, rather the pandemic started, I Stand with Humanity campaign. Maybe you can share with us a little bit about that. But at the same time, what are you doing for the healthcare workers, frontline workers in the United States? I hear you are partnering with some hospitals. Could you share with us about that, please?
Yeah, when the lockdown happened here in India, we quickly gathered, the hard hit people were the daily wage workers. They were living hand to mouth and they had nowhere to go, and then they had lost their job, and small vendors. And so 80 million people around the country, we could reach out and give them rations, food, enough for a week or 10 days. And in multiple such programs, we could reach out throughout the country. And also some parts of Nepal, we did it in Nepal, we did it also in Sri Lanka. We have done in some parts of Africa as well. So our volunteers could do this, gather, food for people. And some places, our volunteers did cooked food. Whereas with the families, we gave them ration that can last for 10 days, say 2 weeks. And other places, daily food was prepared in homes, in groups, in different places. And we gathered the food and then distributed to people, which was very, very, very important and very difficult thing to manage also. And the police forces, with their cooperation and the administration, city administrations everywhere, we could do this successfully. And later on, the government came up with more projects. But this is the thing that we had to jump in and to do it, because the lockdown suddenly happened like that, which people had not anticipated. It was very new. Many had not even thought about it. And then on the other hand, we have the doctors who for the very first time started worrying about themselves before treating a patient. As one very senior doctor in this country said, that, usually when we see a patient, we never thought about ourselves. We would just think about the patient, how we can save the patient. But this time, before we take a patient, we had to worry about ourselves and our family. So there were tremendous pressure on the healthcare workers in North America as well, in New York, in many other cities of America, and South America as well, all of Latin America and North America, India, Australia, many countries. We had programs for doctors to help them to cope up with the stress, unprecedented stress that they were having. And so we conducted workshops on breathing, on meditation, breath and meditation workshops, and the sky techniques. These things, when their feedbacks kept pouring in, we felt it was very gratifying to see that at least we could be of some help to those people who are putting their life at risk and helping the society. I mean, there was not one dry eyes there, I would say, in the workshops, that people were so happy and, I mean, grateful for, getting back that inner strength that they had before the pandemic. So I feel that, and then I conducted meditation every day, twice, so that people from all over the world can participate, because everybody is at home through media, through this technology. Millions joined me in meditating, millions. So in this way, we could just pump in a little more positivity when there was a gloomy atmosphere all around.
I think that you have certainly succeeded at that. I do remember Google tweeting about it with a link saying that there's a surge of people coming to your meditations, and it's been noticed. I have another million questions left. Unfortunately, our time is up, but perhaps I can suggest that we do a part 2 to this conversation, because it's really two amazing organizations with a lot of synergy between them and so much to cover. Maybe something you could consider, because I do want to ask my questions, but I also want to be respectful of your time, also considering what's happening in Lebanon and in different parts of the world. So Jagan, do you have any parting words that you would like to share with us?
No, I think, first of all, thank you for organizing this. And I think I will be quite happy to join the Sri Sri anytime he's available. I think I will consider that my honor. I think my last point is just to repeat what I already said. There is no health without mental health. And we need to have a global solidarity, organizations like ours coming together, bringing our resources together, bringing our tools, energy together, to really try to reach out as many people as possible who needs help. And of course, as you know, 80% of the mental health issues don't get addressed because there is a stigma and discrimination, so people don't go and seek out the help. So it's very important that we need to reach out, and people feel comfortable joining the meditation session with Gurudev. And I'm sure there could be many other opportunities that could come. But that will be possible only through the global solidarity. So I think I call for a global solidarity when we respond to a global crisis like pandemic. There cannot be an individual response, individual country response. There has to be a strong multilateral and global efforts, bringing everybody's resources and energy together. If we do that, we will be successful. If we don't do that, we might be losing many more lives before we learn the lesson.
Thank you so much. And Shri, any parting words from you, please?
I totally agree, Mr. Jagan, and let me wish you to continue. There is solidarity is there from us, our side, from Art of Living and IAHV. We are 100% with you, and we all have to work together. And I'm sure there will be many more organizations, voluntary organizations in the social and sectors and health sector who are working to see a better world. My vision is to see a stress-free and violence-free society. Pandemic is one thing, but beyond the pandemic, if we see the violence in the world, in the global scenario, is simply unacceptable. It's simply unacceptable, whether it's Ecuador, whether it's I remember our Art of Living Center was very next to the Red Cross building in Iraq. So when the Red Cross vacated during the wartime to 2003, so our volunteers called me and said, Red Cross is leaving now. They've been asked to leave, so they are leaving. And so what is the message? So there was such a synergy. So our people said, no, then we will stay back. Since Red Cross is leaving, we will stay back. And they treated nearly 700 patients per day that time. So I'm sure that there are many organizations on our beautiful planet. We have only one planet, and we all need to work together and find out the root cause of violence in the society. So we can all aspire for a violence-free, stress-free society and help people to at least come out of this man-made disaster like what we saw in Lebanon. Natural disaster also we can definitely reduce, but that's not in our hand totally. But what we can as human beings can do is attend to the stress factor that is taking toll of human lives around the world. Thank you so much. And wonderful moderation by Phyllis. You're always in the forefront, and I appreciate your, your, your kind-heartedness and vibrant, inputs. When you're always available for this.
Thank you so much. Thank you.
Thank you. Thank you, Gurudev. Thank you, Phyllis. Thank you so much.
So much, Regan. Thank you. Bye-bye.
Thank you. Bye-bye.